Okay. I did special hair and makeup today because we're recording. Anyway, just teasing. So if you enjoy the live transcripts, then they'll just be on your, although I don't see them popping up. Just one second. There we go. So sorry. There we go. You can keep them on, or if you'd like to turn them off, you can just go to either the CC live transcript or the three dots. And then you'll see an option to hide the subtitle, and you just choose that. And then you can also change the font if you'd like to increase the font. So today's presentation is going to be an interactive one. I will be sort of the wingman for Faith, monitoring the chat box, the comments. And if you prefer to unmute yourself to ask your question, if you are a smaller, well, we're not a large group, so it's easier. You raise your hand, and then I can, just ask you to unmute yourself, and then you can ask your question. So we could try that technique as well. Okay, and then to get started, you'll need pen and paper if you'd like to take notes. However, the presenter has resources that can be emailed after class, including some handouts of the exercises that you will learn today, which is very exciting. And as usual, have a straight chair because we're looking out for your safety. Okay, so but first, we are going to kick it off with a survey, and I see Faith has her camera turned on. Welcome, Faith. Hi, let me, yeah, we'll stay on this slide just before we switch slide deck. But welcome, and thank you so much for all your hard work to putting this together. It really is a first for the Aging Well neighborhood to really do this type of collaboration with a university's research center. So thank you for all your hard work, and we're looking forward to your program. So would you like to explain what Qualtrics is and how easy it is to take this survey? Thank you.
Sure. So before we get started, I was just hoping to have you all fill out what is known as a baseline survey, and it would be conducted through Qualtrics. And I can go ahead and actually drop the link to the survey in the chat box now, and you can go ahead and click on that and take it as I'm speaking about it. So Qualtrics is a third-party service that my university uses to create and keep our survey data for research. It is all anonymous. The survey doesn't use any specific identifier, so none of it can really be identified back to you as an individual. But this research will help me and my research department, my lab, to kind of understand your feelings regarding the effectiveness of fall prevention programs and your just general concerns about falling and aging in general. And then we do take that data and we use it to both create new research projects and questions, and to improve programs like this, to evaluate my Balanced Smarts program, and then to ultimately bring you more evidence-based programs in the Aging Well neighborhood that are specifically honed to your needs and your wants.
That's great. Okay, so do I need to stop sharing my slide deck for you to launch the survey, or no, you're just putting it in the chat box?
Yeah, I did just go ahead and drop the link in the chat box. So I think you can go ahead and keep your slide deck up if you want to go over the programs that are coming up or anything like that while they're taking the survey. It'll just take a few minutes.
Okay, so everybody, hopefully you can see the link that is in the chat box. I did this yesterday. It's so easy. You just click on that link that is in the chat box, and the survey just pops up. And it will take about a few minutes, but it's just like Faith said, it's anonymous. It's just you're helping her with her master's program, and actually the university, so they can continue researching into the things that, you know, we're all concerned about. So hope if you have any difficulties, just please let me know during this time, and I will try to help you out. Well, both Faith and I will help you out because this is new for me as well. So we'll just give it a few minutes while everybody is taking it. And I'll be monitoring the chat box if anybody has questions. Thank you. Okay, Faith, it's 10:10. How much longer do you think we need?
We can go ahead and get started if you'd like. And then if anyone is still continuing with the survey, they can feel free to just keep going while I talk in the background.
Okay. All right, that sounds good. Okay, so I will stop sharing my slide deck and then turn it over to you. There you go.
All right, and are you able to see my screen here?
Yeah, perfect. Looks good.
Okay, great. So let me go ahead and start. So before we dive into learning about falls and fall prevention, I wanted to review a bit from the lecture that Dr. Hernandez, also from my university, gave on July 8th. So a little bit of what Dr. Hernandez discussed were the myths and realities about falls. I provided here on the side a photo of the questions and the true and false answers for some of those myths that we see are relatively strong beliefs about falls. So one of the most interesting ones, I believe, is that People think that using a walker or a cane will make them more dependent. And so we see that people who generally should be using those walking aids don't use them because they're concerned that it will make them more dependent. And actually, since that is false, it is kind of putting yourself at slightly greater risk than necessary. Another thing that he talked about was the fact that people living in long-term care facilities are actually more likely to fall than community dwelling older adults. So one of the goals of my lab personally, and also Dr. Hernandez's lab, is to kind of help older adults understand their fall risk and help them understand how to stay active and healthy so that we can keep you out of those long-term care facilities and keep you in independence in your communities, in your homes. And we even see that about 90% of adults would prefer to stay in their homes. Another thing that he discussed were the outdoor community hazards that are fall risks. Those include uneven sidewalks and poor lighting, and snow or ice on the path, or obstacles on the sidewalk or in your walkway. And we do encourage you, if you see those, to contact your public health department, reach out to your mayor, anything like that, to try and get those solved, and also just be aware of those in your daily life. Another thing that is specific to Dr. Hernandez's work in his lecture was that he studies specifically stooping, crouching, and kneeling abilities. And his work has thus far seen a correlation between muscle strength and your stooping, crouching, kneeling abilities. So if you find that you have difficulty with those tasks, it can be kind of correlated to your muscle strength. And so a way to improve those abilities and your muscle strength are some of the specific exercises that I'm going to go through today. So, what's considered a fall? According to the World Health Organization, a fall is defined as an event which results in a person coming to rest inadvertently on the ground or floor or any other lower level. Falls can lead to fatal or non-fatal injury, and most of the time, injuries from falls are non-fatal. Notably, falls are a major public health issue, and not just for older adults. Fall death rates are highest among adults over age 60, and globally, an estimated 684,000 fatal falls occur each year, making it the second leading cause of unintentional injury death. And that comes after road traffic injuries. Additionally, the World Health Organization and the CDC note that falls are not a natural, normal, or inevitable part of aging. So that means we can prevent falls. However, the definition of a fall may vary depending on what organization or cohort is defining it. This is evident in the different definitions noted in a survey conducted by the World Health Organization, which showed that older adults defined a fall as any loss of balance, while medical professionals defined a fall as an event that leads to injury or ill health. So it's good to consider these differences, but what's most important is how you define a fall. So regardless of a doctor's definition, if you believe that you have experienced a fall, I do encourage you to advocate for yourself and for your needs and to reach out to your doctor. So what are the consequences of falling, and why is it such a public health concern? Well, according to the Centers for Disease Control and Prevention, common consequences of falling include hip fractures and traumatic brain injury. In fact, over 95% of hip fractures that occur in older adults are due to fall events, and 1 in 10 falls cause serious injury, which require hospitalization. Other consequences of falls include loss of independence, or in more extreme cases, the need to be placed in a nursing home. And again, we have seen that, being placed in those nursing homes or living centers do actually increase your risk for falling. Additionally, the research shows that fall events can lead to an increased fear of falling. And unfortunately, this increased fear does more harm than good, because fear of falling may actually increase your risk of experiencing a fall, because you may reduce or restrict your more physical activities, which can lead to musculoskeletal or joint weakness. So the goal of any fall prevention program really should be to inform, but never to scare you. That's exactly why this program emphasizes being aware and not afraid. So we should always remember that falls are not inevitable, and there are actually steps that we can take to improve our chances of avoiding a fall. All right. So I also wanted to provide a more macroscopic view of this issue and really delve more into why it's considered such an epidemic in public health right now. In 2018, 1 in 4 older adults reported falling, and over 32,000 older adults die from falls each year. Unintentional injuries are the 7th leading cause of death among older adults, and 1 older adult falls each second of each day in the US, leading to 36 million falls per year. And most notably, 50% of older adults who fall don't tell their healthcare providers about or discuss their fall concerns. And please let me know if I'm going through this too quickly also.
I think you're doing great, Faith. Your pace is great. I was just thinking about, sharing with your doctor. Like, so is this, the primary care physician, are they trained to guide you or what? I'm just curious how that, that session would go with him or her.
So generally, your primary care physician should be trained in that area and be able to guide you. If they aren't, or if they have any questions or concerns, the CDC does have specific resources for medical professionals in their STEADY program, which is another fall prevention program. So they can kind of guide your doctor with testing you for your fall risk and screening you, and also helping you to come up with a fall prevention plan.
Okay. And I do know, Faith, you've included great resources, which includes the STEADY program at the end of this presentation. So it's probably good to, be your own advocate and, do your own research too, just not depending on your doctor.
Yeah. So the graphic I have here shows the World Health Organization's risk factor model for falls in older adults. Notice that it's broken down into behavioral risk factors, biological risk factors, socioeconomic risk factors, and environmental risk factors. These factors may seem a bit abstract, so generally we try to break it down a bit further. Fall risk factors can be categorized into 2 different types. There are non-modifiable and modifiable risks. The non-modifiable risks are those that can't be mitigated or changed. So we don't have a whole lot of control over those non-modifiable risk factors. Conversely, modifiable risk factors are those that can be mitigated and changed. So the modifiable risk factors are the ones that we should focus on because they are the ones within our control. Here's an extensive list of non-modifiable risk factors. They include being 85 or older, and then gender. Women are more likely to fall than men. However, men experience higher mortality rates from falls. There are also certain health conditions that are non-modifiable risk factors like stroke, Parkinson's disease, dementia, and other neurological conditions, including depression, arthritis, cardiac conditions like an arrhythmia, diabetes, and urinary incontinence. Another non-modifiable fall risk is a previous history of falls, and it has been found that experiencing one fall event is predictive of future falls. So now that we familiarized ourselves with the non-modifiable fall risks, let's delve deeper into the modifiable risks and focus on controlling what we can control.
Okay, we do have a question that came in from Sandra, Faith.
Yes.
And this backs up to, because I was wondering the same thing about the senior living places. Why are they more common in community places more than, in our own homes?
So in community living centers, falls are generally more likely for several reasons. It can be, one, you're not getting as much physical activity as you are in your community. You don't have to do as much for yourself. There are also just more likely to have accidents at these places due to like spills or just kind of medical issues, like specifically polypharmacy, which is one that I will also talk about for community dwelling older adults, but not really knowing how your medications interact. And it's generally just, there are several factors, but the one that we find is most common is actually just that you're not getting as much physical activity.
Yeah. And I imagine anybody who is, in a like subacute or a care center, they're complex patients, so they have a lot going on with them.
Mhm.
So their population, is probably why they're more prone to falling, because they have much more, many more medical conditions, and they don't have somebody there all the time with them either, just like
Exactly.
at home. So, okay, great question, Sandra. Thank you.
So here we have a brief list of modifiable risk factors that we will soon be discussing in greater detail. And those include any difficulties or declines in gait or balance, lower extremity weakness or loss of muscle mass in your legs and feet, adverse drug events or polypharmacy, a vitamin D deficiency or general malnourishment, orthostatic hypotension or drastic changes in your systolic blood pressure when transitioning from like sitting to standing, visual impairments, improper footwear, and of course, home hazards. So now let's look at the most common causes of falls according to Bright Star. So the top 5 causes of falls in older adults are impaired vision, home hazards, medication side effects or that polypharmacy, muscle weakness or decreases in mobility and balance, and chronic conditions. So notice how almost all of these would fall under the modifiable fall risk, except for the lowest one, number 5. So that means we do actually have a lot of control over our fall risk, and it's a lot more than many people really recognize. Before jumping the gun and trying to address all these modifiable fall risks at once, it's important to know your baseline or your original risk. That way you know what you should make a priority to address, and you can be more informed about your own personal risk. So let's talk about how fall screenings work. Well, there are several ways to screen for fall risks. Some, like questionnaires, can be done right at home, while others, specifically the physical test, will require a doctor to monitor you and ensure your safety. Here I have a screenshot of the CDC's study brochure questionnaire. The CDC does offer a great questionnaire, which can be self-administered and will help you to begin to develop a better understanding of your personal risk. This questionnaire can be found in their study program materials inside of the Stay Independent brochure, which I will share with you as well. So while there are a few questionnaires that can be self-administered and give you a basic understanding of your fall risk, the CDC still recommends annual screening for those 65 and older. Although one important caveat here is that annual screening should be done if no falls have occurred in the past year. It's important to get screened or rescreened after any and all fall events, regardless of when you were last screened. And this is necessary again because previous falls are predictive of future falls. So your fall risk does increase slightly after a fall event, meaning it's important to try and understand the cause of that fall and reassess your mitigation efforts accordingly. You can be screened by your primary care physician or other licensed physical therapy centers in your area. So now that we know why screenings are important, let's look at what actually happens at these screenings. At your screening, your doctor will ask you fall-related questions and may perform a few balance tests, including the TUG test, which stands for timed up and go, which is just seeing how many times you can go from sitting to standing. There's also the 30-second chair stand and the 4-stage balance test. And if you are an imminent fall risk, you will begin creating a comprehensive plan to monitor and reduce your risk. While if your doctor finds that you are not an imminent risk, again, you should, begin or continue preventative measures and be rescreened annually. So while screenings are important, there are other steps that you can take to gain a better understanding of your specific fall risk, which include talking to your primary or your primary care physician about any additional health issues or concerns you may have, even if these don't seem related to fall risk. Again, you can also see a physical therapist. Sorry. And if they help your doctor to create a fuller picture of your overall health, it will help them to treat you accordingly. Additionally, you may want to seek out a podiatrist if you experience any foot pains or issues with your footwear, an optometrist to check the health of your eyes and vision. And the Academy of Ophthalmology recommends routine eye examinations at least every 3 years for people 40 to 54, and exams at least every 2 years for people 55 and older. And we do generally also recommend that you are screened annually if you notice any changes in your vision at all. If you're interested in learning more about what other leading organizations say about fall risk in older adults, I would also recommend perusing the CDC, AARP, NCOA, and Senior Falls Prevention Coalition websites. However, nothing really beats talking about any specific concerns that you may have with your healthcare provider as well as your family, so that they are able to offer any necessary assistance with creating, implementing, and maintaining a fall mitigation plan. So that concludes the informational portion of this session. Now I'd like to go over some evidence-based exercises that we can actually do together. Oh, here we go. So the first one is actually a stretch, and it is the neck rotation and side bend stretch. So the purpose of this is to improve the range of motion in your neck and help you to stretch your upper back and scapular muscles. This exercise may cause your neck to make some crackling sounds, and if this is painful, please do stop the exercise and only bend your neck in a range that feels pain-free. If you do feel any dizziness when you're bending your neck, please do stop the exercise. And of course, only perform movements that don't cause you any pain or dizziness. None of these should really hurt or make you really, uncomfortable in any way. And I have also provided a video
Step
to
1.
show us how to do it as well.
Sit comfortably in your chair. Step 2. Look to the right as far as comfortable and hold for 5 seconds. Then look to the left as far as comfortable and hold for 5 seconds. Step 3. Bring your right ear to your right shoulder and hold for 5 seconds. Then bring your left ear to your left shoulder and hold for 5 seconds.
And here we have the inner thigh stretch. The purpose of this is to improve your range of motion in your hips and thighs and increase your functional ability when standing, walking, and stepping. So what we're going to do here is stand with a chair for support. So if you need to go get a chair or anything like that, please feel free to do that now. All right. And leg stretches like this one are important to do regularly because as we age, we do lose a lot of flexibility in our hips and legs. And this loss of flexibility can severely reduce our ability to function independently in our home and community. And during this exercise, you'll want to continue breathing normally in through your nose and out through your mouth. And then we're going to make sure we're pointing our toes outward, almost like a duck, and keep your back straight as you lower yourself down. And again, if you feel any pain, you should stop.
Step 1. Stand with chair support. Bring feet apart as far as comfortable. Step 2. Bend your knees out to the side and pause. Hold this position for 10 to 20 seconds. Then repeat this stretch 2 more times. Continue to breathe normally, in through the nose and out through the mouth. Point your toes outward. Keep your torso erect while lowering yourself into the stretch. The stretch should feel comfortable. Stop if you have any pain.
And again, please let me know if we're moving too quickly. I can slow down.
Step 1.
All right, and here is another highly recommended exercise, also from the CDC. It's called the chair rise exercise. And the purpose of this is to strengthen our muscles and your thighs and your butt. And the goal really is to eventually be strong enough to do the exercise without using your hands to get up from the chair. This is also both a great screening assessment for lower extremity strength and a way to gradually increase your strength. Ideally, this exercise is repeated 10 to 15 times, but if 10 or 15 reps is too difficult for you in the beginning, do as many as you can, and eventually you will improve your strength and work up to more reps. And I have just provided a graphic here of what the whole thing put together looks like, but I will be doing it with you, and I will have the steps again on the screen so that you can read through them as we're doing it. So we're going to sit toward the front of our chairs with our knees bent and our feet flat on the floor, shoulder width apart. We're going to rest our hands lightly on the seat on either side, keeping our back and neck straight and our chest slightly forward so that it can help us get up a little bit with momentum. We're going to breathe in slowly, lean forward, and feel the weight in the front of your feet. Breathe out, slowly stand up, using your hands as little as possible. We're going to pause for a full breath in and out, and then breathe in as you slowly sit down. We're trying to control our lowering as much as possible. And then we breathe out. So let's go ahead and do that again. Up, in and out. And then lower ourselves back down. And again. And again. And one more time. All right, so we didn't do the 10 reps there. I just wanted to give you kind of a bit of a demonstration so that we can keep moving forward. But again, we will be sending this slide deck out if you'd like it, and also a graphic showing a few of the exercises and a bit of the key information that I'm going through here today. So you will be able to see this again and do it on your own time if you'd like. And of course, the videos that I'm providing are on YouTube as well from the Elder Gym channel, and I would highly recommend that channel if you just like to get some more exercises or ideas, or if you're confused about how to do anything. All right, so now we can move on to chair yoga. Chair yoga is another great way to get in your workout and improve your balance. Several studies have actually shown that yoga is a low impact workout that improves flexibility and circulation, in addition to having positive effects on stress reduction, pain management, and mental health conditions like anxiety and depression. So now we can actually dive into some chair yoga exercises. Okay, so now let's do an overhead stretching exercise. This exercise is going to stretch your deltoids, obliques, and your latissimus dorsi. And of course, the health benefits are improved posture, which is really great for both balance and fall prevention. alleviating breathing difficulties and strengthening those abdominal or core muscles, which again is great for helping your center of balance. So for this exercise, what we're going to do is we're going to breathe in, and then we're going to pull our arms up overhead as far as comfortable. Breathe out. In and back down. And out. So you should really feel that stretch in your arm area here, and also in your back a bit. And we can go ahead and do that one more time just to make sure we've got it. In, overhead. And I like to breathe out up here just because my nose is a little clogged right now, but if you'd like to hold it and just bring it back down, you can breathe out on your way down as well. And again. All right, great.
Hi, Faith, it's Allison.
Yes.
Hi, would you mind repeating the name of the YouTube channel that you mentioned a couple minutes ago?
Oh, sure. Sorry. It is called Elder Gym. I can actually put a link to it in the chat if you'd like.
Great, thank you so much.
Yeah, no problem.
A place to work out safely can.
And I've just put that down there again. All right, so now we can move on to a neck stretch. So this is going to relieve stress and ease some neck pain, and also just kind of help your entire body to relax. So we're going to sit up in our chair and don't let your back touch the back of your chair. So you're kind of using your core muscles here as well. And then extend your neck slowly upward so that you feel the head or the crown of your head rising towards the ceiling. And your chin should kind of stay level still. And while holding the base of your chair with your right hand, slowly reach upwards with your left hand toward your left temple, or your right temple. And then you can go ahead, take a deep breath. And upon exhaling, you can gently dip your left ear towards your left shoulder without bending your back or raising your right shoulder. So we're going to try and keep this down. And then we're going to take a few breaths in and out in this position. And then we can alternate towards the other side. So we're going to go ahead and do that again. Make sure we're sitting upright. Our crown should be being pulled up. And then we can go ahead. Oh, we did the left, so we're doing the right. And deep breath. All right. And this other one is the reverse arm hold pose. And so we're going to begin in a seated position with our back straight apart, or our back straight and apart from the back of the chair. All right, and while we inhale deeply, we're going to reach our arms straight out to the sides at a low angle. So that's going to kind of, I'm hoping you can see me here, like an eagle, really. And then we're going to exhale And reach our hands behind our back, bending our elbows just slightly like you can see in the image there. And then arch your back if you're able to feel that stretch in your shoulders. And then we're going to hold that for a few breaths. All right. I generally hold for 5 breaths in and out, but if you would like to do it for fewer or for longer, please feel free to do whatever is comfortable for you. So for the chair pigeon, you'll want to sit upright with your back away from the back of the chair again. A lot of these really do focus on kind of using those core muscles. Those are also what we're trying to build for balance. And then we're going to face forward. And gently raise your left ankle to rest on the top of your right knee or thigh, whichever is more comfortable. And if you have trouble bringing your ankle to your knee, feel free to use your hands for assistance to kind of hold it there for a bit. And then we're going to inhale and then flex your left foot and then bend forward. And we're exhaling as we bend forward. And then we're going to take a few breaths in this forward position. And back to upright. All right, and now we can lower our leg and we're going to switch to the other side. And we're going to bring our right ankle out to our left thigh or knee, and we're just going to repeat those steps. So we're going to gently raise our right ankle to the top of our left knee. And again, please feel free to use your hand if you need assistance. You may find that one side is more flexible than the other, and that's okay too. That's generally pretty normal. So if you do need to use any assistance on anything, please go ahead. We're going to inhale deeply. We're going to flex our right foot and bend forward while we're exhaling. We're going to stay in this position for a few breaths. And back upright. And so you're going to feel that stretch in your pelvis as well as your hips and really in that thigh area. All right, now we have the seated forward bend. And you begin being seated forward, sitting upright with your knees separated about shoulder width. Oh, no, sorry, wrong exercise. With your knees touching and your feet on the floor. Let's see. All right, and we're going to take a deep breath in. And while we're exhaling, we're going to slowly bend forward. I'm going to back up so I don't hit myself on the desk. And you should feel your spine really stretching one vertebra at a time. And please lean forward only as far as you can without feeling any strain or discomfort. This also should not be painful. And we're going to hold this position for several deep breaths. And then return back to our upright seated position. And this is a really great one for stretching your spine. I generally find that it feels really good. I even do these stretches when I'm like in the library for long periods of time or sitting at my desk because, you know, I also would like to do these stretches and keep being flexible and mobile. So these are good to share with anyone. If you'd like to do them with your family or friends, I do encourage you to do that as well, or find any community centers or even the classes that we have here at the Aging Well neighborhood, like the Qigong and those senior fitness classes are really beneficial. All right, so that concludes my presentation. I do actually have a few bonus exercises that I threw in just in case we did have a bit of extra time. But a note that I really, really want to take home, or I want you to take home with you today, is that falls are preventable. And I have a graphic here from the CDC study program. These are 4 key takeaways. We want you to speak up if you have any concerns about falling. Keep moving, stay active. Again, a fear of falling or even just being inactive really does increase your risk for falling because those muscles do atrophy if we don't use them. It really is a use it or lose it kind of thing. And our joints do lock up, and that makes us 1, more likely to fall, and 2, more likely to be injured severely when we do fall. 3, we'd like for you to have your eyes checked regularly. Visual impairment is one of the leading factors that causes falls. So if we can help you to have better vision, you can see things when you're walking around at night, or if you're walking somewhere during the daytime and maybe there's something small on the ground, we want you to be able to see what's happening. And of course, make your home safer. We didn't really get into home modification this week. However, I do have a presentation next week as well, and we will be delving more into topics like nutrition and home modification. And I will also be talking a bit more about how you can specifically be aware of potential medication side effects that may cause like dizziness or polypharmacy when you're taking several medications and there may be an interaction that you're unaware of, how we can stay on top of things like that. And I've also provided my references and a list of websites and research articles that I encourage you to check out if you are really interested in delving into this topic a bit more. And some of these resources are also available on the handout that Renata can send to you later today. And these bonus exercises do actually include a wall. So if you have a wall nearby, I do encourage you to do them with me. Again, they are more stretches really, but if you don't, there's a video that you can follow along with. And when you do have time or you are near a wall, you can do them then. So this first one is the calf stretch. And the purpose is to increase flexibility of your knees.
Step 1. Stand facing a wall. Place your hands on the wall. Step 2. Step forward with your right foot. Lean your hips toward the wall. Keep your back leg straight, heel on the floor. Hold position for 20 to 30 seconds. Repeat with the other leg. Breathe normally, in through the nose and out through the mouth.
And I know that keeping your heel on the floor for your back foot may be a little bit difficult if you're having a bit of flexibility issues. So just try and keep it as close to the floor as you can. And then gradually, if you continue to do that, you will be able to regain some of that flexibility.
Step.
And here we have the hip side stretch, which is to improve balance and range of motion in the hips.
Step 1. Stand next to a wall about 12 inches away. Your left side facing the wall. Step 2. Cross your right leg over your left leg. Bring your left hip in towards the wall. Hold for 10 to 20 seconds. Continue to breathe normally, in through the nose and out through the mouth. Then repeat, crossing your left over your right. Bring your right hip in toward the wall.
And for this one, I would recommend if you are having any balance concerns or issues, since we are crossing our feet, if you would feel more comfortable still having your steady chair nearby for support, I really do recommend having something sturdy near you for any exercise, regardless of age, just because sometimes we do lose our balance, and it is kind of better to be able to catch yourself on something.
Step 1.
And that actually concludes my presentation for today. So I'm going to just go ahead and end on this. Again, falls are preventable. And I hope that you learned something or you found something interesting about this, and hopefully you can take away a lot from Balance Smarts in general. And if you do have any other program suggestions going forward, I would love to hear them. I'm very interested in program development, specifically for older adults. So any issues or concerns or anything you're even just remotely interested in, I would love to hear about so that I can look more into it.
Wow, great job, Faith. I can't say enough about this. Again, you exceeded expectations and you made it so easy and clear and doable. And if we can challenge ourselves every day doing just those simple exercises, and maybe start out with 5 reps or 10 reps, but keep building up. I think that's the key, and that could be our strategy, right? For preventing falls. So I think this is really great. So if, as long as we have Faith here, if anybody has any other questions or, like she said, suggestions, because really, she's here to not just learn, but help us help ourselves. And this topic, we've done fall prevention before, we've done balance programs, but this really delved into the mechanics of balance, and the fact that we can really, if we're aware of our abilities, we can really prevent falls. So I'm just checking. I have a lot of great comments coming in. From Allison, thank you so much. This was a fantastic program. Sharon, wonderful presentation. Thank you so much. And Usha, super and simple, effective exercises. That's true. We don't have to overcomplicate things. I love this. So I cannot wait to hear your program next week. Keep your comments coming in. I'm just going to share my screen once again, because there's one key slide here that I need to share with everybody. Okay. There we go. So I made a special slide. So actually next week, there's going to be 2 sessions of Balance Smarts. One is to make up for the program that we unfortunately had to reschedule because of a voice concern or no voice. And there's a separate link. It's going to be a different link that you normally join with. So I will make sure everybody who was at today's class, as well as last week's class, or 2 weeks ago, I should say, has the new link to join on Monday. So July 26th is a Monday. So again, we have 2 classes next week. Monday, July 26th, and then on Thursday, the 29th, is when the session wraps up with Faith's professor, who will talk about, more of the research that they're doing and what they're looking to do with.
I think we
this.
actually switched them. So
Oh,
on
you did?
Monday, Shannon, my advisor, my research advisor, will be here, and she'll
Okay.
be talking about our lab and our research and our daily balance project specifically. And then next Thursday, I will be doing the second series of the balance smarts that I showed today.
Okay, great. Yeah, no worries. So yeah. Okay, so so everybody's clear. They will get the link for Monday, as well as the next Thursday, which will be your second class. And I'm really anxious to hear about the nutrition and all the other aspects that you've researched on. It's been very helpful and valuable information. So we have a hand raised. Let's see. So Galaxy, do you want to unmute yourself and ask your question?
I think I did. I have a quick question. I have a friend who has some walking issues, and her doctor told her to walk on uneven ground, that would help her keep her balance. What do you think?
So that sounds like it could potentially be a musculoskeletal issue. And since unfortunately I don't know your friend or her specific or their specific medical history, I would recommend following that doctor's medical advice. However, if they do feel uncomfortable with that, or if they feel for any reason that maybe that puts them at greater risk, I would actually recommend going to a physical therapist or getting a second opinion, just to make sure that that specific advice of walking on uneven ground is useful to them. Generally, for most of us, we walk on even ground. Our feet actually find the pattern of the ground or gait very easily. So even like with uneven steps, if you're going up a staircase where one step is even a few centimeters larger than the other, you're going to hit that step because your foot kind of gets into a natural stride. But it could be different in your friend's case where she or they may be testing their balance, and that could potentially be more useful to them.
Yeah, she just said that her doctor said all seniors should walk on uneven ground. I said, okay. So I try that sometimes.
I would recommend, if you feel comfortable with that, then you are free to do it. I wouldn't say specifically to avoid uneven ground, but since it is more of a tripping hazard just for everyone in general, that's why it comes so evident. It becomes so evident on our fall prevention and concern list for those outdoor hazards.
I hear you. Yeah.
But if you are doing it intentionally, again, then you are more aware of it, so you are less likely to fall. The issue kind of arises when you're kind of just walking on a regular ground and you don't notice that it's uneven. And so again, you found your stride already, but it's interrupted by this uneven ground, and that's where we are more likely to see falls.
Oh, thank you.
Yeah, no problem.
Yeah, great response, Faith. Oh, and I think that was, I don't see anything else yet coming in. So yeah, so we're clear on the 2 classes next week for the balance series. And let's see. There we go. And then please join us tomorrow. It's already Friday tomorrow. This is crazy. For Senior Strong Fitness. And again, you want to build up your stamina, and you guys already know this, by doing these classes. It's one of the reasons that we offer so many, is to build up your strength and flexibility so you can be more mobile and stay mobile, right? That's the name of the game. And again, next week, we're going to focus on balance and strength with the Impulse Rehab folks. And then also on Monday, then Monday we have 2 programs. So in the morning, don't forget, at 10 a.m. is the second balance class series. But in the afternoon, we have a book session with Trish, who loves Stephen King. So please join us. And if you get a chance, try and read the Duma Key book that she'll be reviewing. She's also going to delve into more personal sort of stories about Stephen King, not just that particular book. So you don't have, it's not a prerequisite. Let's see, I see more messages. Okay, and Barbara, I see that your mic is unmuted. Oh, okay, never mind, she left already. Okay, thanks, Allison, she's my wingman. Okay, and then Qigong is on the 28th on Wednesday at 11 a.m. Looking forward to that. And that again incorporates some of what Faith discussed today about how breathing is so important in even how it relates to balance. And why am I? There we go. And then we have a visit with Leslie Goddard as she does the mid-century cuisine, how we used to eat in the 50s or 40s, 50s, and 60s, kind of scary, but I think we've come a long way. And then it's not too late to join our the WITS Wellness Health and Wellness Study. It does start in a couple of weeks, so it's coming up quickly, but call if you qualify and you'll find out if you qualify for this study. It is a commitment, but you invest in your health, and the reward will be just out of this world. So also then we have Act 2 Creative Writers Discussion coming up on August 2nd. And then Patricia Faust, our brain expert, is coming back and talking about older adults and decision making. And so again, thank you everyone for being here and being a part of the Aging Well neighborhood. This couldn't be possible without donations from individuals as well as our many grant funders. So we so appreciate them. So thanks again for joining us, and I hope to see you tomorrow for Senior Strong Fitness. And Faith, I can't thank you enough either for being here and all your hard work. It's been tremendous. It's been a really a program that gave us so much value, and everybody will get this presentation in addition to the link for the makeup class next week, in addition to your handout. So looking forward to that. Okay, great job. Okay, let's see, one more. My chat box is flashing. Yes, Allison said this was a particularly great program. Yeah, and she enjoyed it and learned from it. And I can't agree more. So, all right, well, we'll be talking soon, Faith, and everybody have a good rest of the day. And thanks again for joining. Bye-bye.